Hello, you're welcome. My name is Dr. Chris Williams, and I will be hosting you on this telecast called Well Again. Okay, so you're welcome to Well Again with Dr. Chris Williams. Today we'll be talking on COVID. What else would one talk about if not COVID-19? We've heard it on television. We've heard it. If you open the newspapers, you see it. Even on social media, it's the in thing. It's what is being talked about everywhere. And just like any other thing that is being talked about everywhere, there is a tendency for all kinds of things, all manners of things to be pushed and said that are not real. In this episode, I want to help you distill. I want to help distill the accurate knowledge of about COVID-19 in this episode. I've titled it Why COVID-19 Kills Fast and How to Avert It. Why COVID-19 kills fast and how to avert it. We know that it is a viral infection. COVID-19 is a viral infection. It's from the same family as the SARS virus. Okay, it's caused by the same virus. It's caused by a virus from the same family as the SARS virus. As a matter of fact, some people call COVID-19 virus, they call it the SARS-CoV-2. SARS-CoV-2, that's what they call it. Now, we understand that it is transmitted by contacts with droplets from an infected person. Okay, so whichever way the droplet is being propagated, that route will propagate COVID-19, whether the person sneezes or coughs, or the person puts their mouth puts their hand in their mouth, or whatever. Any droplet from an infected person, whether it's on the table or it's on the door handle or anywhere. If before the virus dies, somebody who is not infected gets there and touches it, and then also puts it on their face or on their mouth or whatever, the person can get infected. A couple of things about, as we talk, we'll be seeing a whole lot of things about that makes COVID-19 very peculiar, all right? We'll be seeing a whole lot of things that make it very peculiar. They told us that it came from an animal, it came from bats and all that. Now, that's a mystery. I will not want to go into it, but that's a mystery because it's usually for a virus to mutate from an animal and be functional in a plant. It takes many, many years. It takes tens of years. Okay, it should take tens of years. So viruses don't jump from animals and then be active in human beings. So, but that's another thing for another day. Let me keep to myself the things that some of the things that we think happened about COVID-19. All right, but why is it so effective? Within 3 to 6 days of being infected, an infected person would have transmitted it to like 2 to 3 persons. Now, that's very high. That's very high. But within 3 days or 6 days, 3 to 6 days of being infected, if somebody gets infected today, within 3 to 6 days, they would have transmitted it to 2 or 3 other persons. That's very high. We know that the incubation period is between 2 to 14 days, and then that there are different manifestations of infection or with COVID. There is the asymptomatic stage, different stages, okay, or manifestation. There's the asymptomatic stage where somebody is a carrier, they are positive for the virus, but they don't have any symptoms. And a lot of persons are there, okay? So such person, if not treated, he will continue to be a carrier, and then maybe along the line, the infection will overwhelm their immunity, and then they will become symptomatic. So some people are symptomatic for many days. Some people can actually be symptomatic for weeks and for months. Okay, the second stage is the mild stage of disease, where the person may be having maybe cough, they may have fever, and they may have breathless, shortness of breath. Okay, and then if it progresses, if nothing happens, it can lead to the moderate level of sickness. At the moderate level of sickness, the shortness of breath, it really becomes intensive, and the person may need oxygen. They may need to be oxygenated in the hospital. At this point, the person will need to be oxygenated in the hospital. Usually, people who are in the mild stage can treat themselves at home with self-isolation and some of the things that we'll be talking about. In the severe stages, stages towards death, the person will need a ventilating machine or a ventilator, and literally the person's breath or breathing will have to be taken over. And we have heard so much about all that. So those are the stages. Now, what are the signs and symptoms of COVID? It's important you listen to this because through the lockdowns have been lifted in many places. And maybe in the weeks that we're entering, also more and more places, especially in our country, will lift the lockdowns. But that doesn't mean that it is over with COVID-19. COVID-19 will be here with us for a long time to come. And we need to know what to do about it. So what are the signs and symptoms? Fever. Now, these signs and symptoms are not sacrosanct. In other words, they are not things that must happen in a particular patient. It depends on different reactions and different levels of immunity, all right? And then it also depends on how long the sickness has been there sometimes. Okay, so fever, it may present with fever. And in some persons, the fever is low-grade fever. Low-grade fever means it will be like if you are having fever, but let's say some people will call it internal heat. You are hot, but maybe somebody touching you, if the person may not be able to say that you have a fever. Okay, so fever. Okay, and then myalgia, pains all over. Generalized body pain. In some people, it can progress to coughing or congestion in the upper respiratory tract, that's in the throat, and then if nothing is done, it can lead to the lower respiratory tract, that is in the lungs and in the bronchi. Okay, so we've talked about fever, we've talked about myalgia, shortness of breath, and it can also lead to cough. Okay, so cough is also a manifestation. Okay, so it might be mild cough, it might be really bad brassy cough, but usually what is common with the cough is that it is non-productive cough. All right, it may lead to vomiting. By the time the gastrointestinal system is affected, it may lead to vomiting, it may lead to diarrhea. Okay, it may lead to chest pain when the lungs are infected and there's cough, and it may lead to chest pain. It may lead to also fatigue. Fatigue is a sign and symptom of it. The person will be, you just be tired. You will not have energy to do the things you need to do. It may also cause anosmia. Anosmia is loss of the sense of smell. And recently, I've heard a lot of persons call me and say all of a sudden that they can't smell. Okay? If such a thing is happening to you, you may want to suspect COVID. I'm not saying it is definitely COVID. You may want to suspect, especially if you developed it recently. Anosmia many times will come with loss of taste. You can't taste food any longer. You can't taste whether it is delicious, or it is sweet, or it is sour, or it is salty. You cannot taste it. And then as the disease progresses, the person may have pink sputum. Pink sputum. What is pink sputum? When your sputum begins to mix with blood. And now the disease has really progressed in that kind of person because after some time there is clotting and there is bleeding into the lungs and into the different places and all that. So those are the signs and symptoms. Now it's important to say that COVID affects not only the lungs, it affects the whole body. It affects the brain, it affects the heart, it affects the spleen, it affects the liver. Okay? It's just the signs, it's the signs and the symptoms of the liver affectation that are quickly visible, but it affects several areas of the body. Now, when one gets infected, talk a bit now about the pathology. When one gets infected, we several things. Number one, the first thing is that there is allergy. The first thing is that there is allergy. Now, allergy means once the virus finds its way into the body, there are the first line defenders in the body called macrophages. Once the virus enters the body, enters the cell, the macrophages stand up and to swallow the cell. They form around the cell and swallow it. That's the viral cell. The macrophages in the cell form around the viral cell and swallow it. Okay? Now, this is how allergy happens in the body. And then the macrophages will invite the T cells. And then the T cells will come. Usually there are thousands, if not millions, of different types of T cells in the body. In a normal infection, if the macrophages have identified an assailant and have swallowed it, and they have called out to T cells, in normal infection, maybe only about 5 types or 10 types of T cells will respond to that call. But in COVID, we find it behaving differently. And when I come back after this timeout, I will explain how it behaves. And that's what stands it out and makes it very unique and very devastating. Please do not go away. I will be right back. Okay, you're welcome back. It's part 2 of this talk on COVID-19, why it kills fast and how to avert it. We started talking about the pathology. Pathology means how it affects the body negatively. Okay, so we said when first the virus enters the body, it enters into the cells of the body, and the first line defenders called the macrophages will identify the virus and swallow it up. And then they raise alarm and say, guys, there are some new assailants, and come help us fight them. So they recruit the T cells, and then the T cells will come and join the fight. Now, there are different types of T cells, thousands of different types of T cells in the body. In a normal reaction or in a normal reaction to infection, only about maybe like 10, sometimes 15, sometimes 20 types of T cells will be recruited to fight a particular infection. All the T cells in the body don't get recruited. Okay? But in COVID-19, we see an overwhelming number of T cells being recruited. Literally millions of different types of T cells are recruited. Okay, so leave that because I will use that knowledge when I come back, when I begin to talk about cytokine storm. Now, so T cells are recruited, and then T cells recruit T helper cells. God is so powerful. The Creator is so powerful. He look at the lines of defense in the body. Macrophages, T cells, and then T helper cells are recruited, and then the basophils are recruited also, and all that. So all these things I'm talking about is tracing how allergy happens in the body. So COVID-19 causes allergy. Your body, there's a reaction, there's an allergic reaction in the body, and then it also leads to, I've talked about overwhelming recruitment of T cells, or if you like, overwhelming T cells response. Now, this is what makes COVID-19 very devastating, very devastating. There are some cytokines. Cytokines are some kinds of cells. So I will not bother you or belabor you with all these technical things, but there are CCL3, there's CCL4, and there's CCL5. In COVID, it's the CCL5 that are mostly recruited, and then in response to recruitment or release of CCL5, the CCR5 are recruited. What all this jargon I'm talking about leads to is an overwhelming inflammation in your body. There's literally riot in your body. A major part of the armies of the body go to war, and they start pulling down different cells. They start pulling down all these cells that are infected, and in so doing, it literally disrupts the activity. Call it, there's a war, there's a breakdown of law and order in the body. So this will lead to an overwhelming inflammation in the body. Overwhelming response of T cells lead to overwhelming inflammation in the body. We've talked a lot about inflammation in time past. This will lead to pneumonia. Pneumonia that is not in this world. Very high pneumonia, infection and inflammation, of the cells of the lungs. It also leads to inflammation of different parts of different cells of different parts of the body. Inflammation in the liver, inflammation in the kidney, inflammation in even in the brain, and in all those things. So there's inflammation of the lung parenchyma, and there's also fibrosis, massive destruction of the tissues of the cell. All this begin to lead to reason why the person begins to be breathless, and after some time, if it continues, they can't breathe on their own. They need to be helped to breathe. So it damages the lungs, and then it also, if it's uncontrolled, it will lead to damage of the heart, damage of the kidneys, and damage of the brain. So damage of the heart, it can lead to myocardial infarction. Damage of the kidneys, it can lead to renal failure. Before you know it, so there's multiple organ damage before you know it will lead to shock, and then from shock the person dies. Now that's the pathology of COVID-19. Because we are not out to turn you to a doctor, we should concentrate more on what you need to do, what things you need to do. Now, there's something I would like to explain before I go on to talk about solution. It is called herd immunity. Herd, H-E-R-D, a herd of animals or a herd of cow. H-E-R-D. So what is herd immunity? Herd immunity is a process by which an infected community develops collective immunity against a particular disease. Now, before herd or collective immunity can be developed, at least 50 to 67% of the population need to have been infected. Bring it nearer home. People have malaria in Africa every day. Kills some people here and there, but a vast majority of the persons in Nigeria have one time or the other been affected with malaria. So in malaria, we have herd immunity to malaria. In Nigeria, we have herd immunity. In Africa, we have herd immunity to malaria. That's why, but they don't have it in the Western world. That's why if you go to the Western world, and then maybe you were bitten by a mosquito here before and then it started manifesting there, and then you go to the hospital and you say you have malaria, they start running up and down. They can actually, depending on where you go, they can actually push you into a room and quarantine you. Why do they do that? It's only malaria. Just give me chloroquine, let me take and go. Say no, because they don't have herd immunity there. If they don't do something drastic about your malaria that you brought there, it could become an epidemic in that locality. So herd immunity talks about the about how a populace or a community of people have developed together or joint immunity concerning an infection. Now, and before herd immunity can be achieved, 50% to 70% thereabout of the populace have to have been infected with that infection. That's why I said you should pay attention. COVID-19 will not, it's not going away in a hurry. It's not going away in a hurry. Bring it nearer home. We're about they say we're about between 120 million and 200 million or 150 million in Nigeria. I'm saying that before we can have herd immunity, before we can get to a place where we stop worrying about COVID, not stop together worrying, but we worry less. Just like we don't worry every day about malaria. If the boy is just born and he has his own bout of malaria, he has been initiated, and then we forget everything. So before we can get there, about 70%, 60% to 70% of Nigerians need to have been infected. Now that is serious. That is serious. So a community of people can achieve herd immunity 3 ways. Either you just allow a free-for-all, let the people start getting infected, and by the time we get to 50%, 70% infectation, then would have developed herd immunity. But that option is a very terrible option, because before we can get there, many people would have died out. That's why the governments of the world declared isolation. So a second way by which a community of people can develop herd immunity is by vaccination. So you take either dead antigens of that you killed viruses. We call them antigens. You kill viruses, you put a little, just a small quantity in controlled killed viruses. You put it in the body of the people, in the body of somebody who has never been exposed or infected, and the macrophages stand up, the T cells stand up, and then the T helper cells stand up, and then and the person will develop immunoglobulins or antibodies towards that infection. So that's one way. We have talked about one way. Let all the people start getting infected. We'll get to 50%. We said it's not an option. Second option, vaccination. And thank God, there's not exactly an accepted vaccination right now, but people are making efforts. They did they tried to produce one vaccination in the Oxford University, but I learned that it failed the trials. There's another vaccination called Moderna. There's another one that Pfizer and a company in Germany are working on. There's another one called Sinovac that the Chinese are working on. Different kinds of vaccination. 2 types of vaccination: the one you do either with dead cells or the one you do with weakened cells. We call it life attenuated. The virus is still alive, but it's as good as dead. Okay, so it will get into the body and create messenger RNAs, and so that we'll have some kind of immunity towards that. Okay, so until we get to the point when there's vaccination, we need to explore another way of going towards herd immunity. And when I come back, I will tell you about it. This is where it concerns you. Please do not go away. I'll be right back. Okay, you're welcome back. We are talking about why COVID-19 kills so fast and how you can avert it. We looked at what type of infection it is. We have looked at the signs and the symptoms. We have looked at how it causes, the devastation it causes. And then I explained the word or the term herd immunity. I said herd immunity is combined immunity that a community of people develops towards a particular infection. And it has to be 50, before we can develop herd immunity, 50 to 70% of the people will have to have been infected. Okay, that's an option. That's one way of developing herd immunity. Another way of developing herd immunity is to have vaccinated 50 to 70% of the population. Now, that's a tall order. Now, where we are now, the vaccine has not been, no vaccine anywhere has been ratified by any government of the world. WHO has not ratified any particular vaccine. That's one. Number two, how long before that vaccine will be available to 50 to 70% of the world population? The vaccine that Pfizer and BioNTech is a German company, are working on. They are saying that if they get FDA approval, they will be able to make at least 20 million. They will be able to have manufactured about 20 million by the end of 2020. America alone is 250 million people. Nigeria is about 150 million. Talk about the billions and billions of people in China and India. Okay, so even if the vaccine is, if a vaccine is available today, it will take months, if not years, before it goes round. So there has to be a third option, and the third option to developing herd immunity is prophylaxis. What do I mean? I mean taking up our immunity, systematically increasing our immunity, showing up our immunity, your immunity, my immunity, your immunity, my immunity, all the immunity of the people, so that we get to the point where even if the now lockdown has been lifted, people are back to their business. And you know, I was driving through the city, our city, one of these days, and I saw that even though government called this systematic lifting of lockdown, people are back to their business. People are back to their business. They're entering cars, they're entering buses. I even saw that the wearing of the masks, law enforcement agents are not able to enforce. How many people do you want to catch? Okay, so there has to be another way, and there's another way. That's the good news. It's called prophylaxis, learning to increase your immunity and my immunity, so that we get to the point where even if we are stung by the infection of COVID, our body will be able to parry it. I like that word. You know, when a goalkeeper, you give him a hot shot and then he parries it and throws it to the over the bar. That is what I'm talking about. There are two ways to do it. The first way you can increase your immunity is by building it up naturally. You build up your immunity naturally with the use of supplements. Vitamin C. Vitamin C. Just before the lockdown, I started talking about it. I started encouraging the people about vitamin C and N-acetyl-cysteine. We'll talk about N-acetyl-cysteine. Vitamin C. There's only one other antioxidant that is more powerful than vitamin C, and we'll talk about it, and that is glutathione. Vitamin C is a chief in the antioxidant world. What happens is that when, either due to stress or due to infection, your body produces some elements we call oxidants, reactive oxygen species. Oxidants, or if you like, call them reactive oxygen species are either oxidants or free radicals. Look at that name, free radicals. When you are infected, the toxins that are coming out from the waste of the virus cause your body to produce a whole lot of oxidants and free radicals. And these are the things that join hands to destroy the body. Now, vitamin C is a powerful antioxidant. Very powerful antioxidant. Without trying to confuse you about it, try and take at least 4 or 5 grams of vitamin C on a daily basis. And you know, I forgot to bring to set today. I wanted to bring my container of powdered vitamin C. I recommend powdered vitamin C to people. Powdered vitamin C. The tablet vitamin C that you have on the shelves in the pharmacies, most of them are 1,000 milligram vitamin C. If you get powdered vitamin C and you take half a teaspoon and you put it in water and you stir it and you drink it, you will be drinking about 3 to 4 grams of vitamin C. So by the time you do that twice a day, you have taken about 8 grams of vitamin C into your body. I told our people in church to start doing that, and not one. We have not had one complaint. One complaint. We have not had one complaint. Even some persons who developed some concerns before they heard about it, I said, go get vitamin C. They developed some things that appeared as if it was COVID. I said, don't worry, just go get vitamin C. One of them called me particularly and said, I've been taking it, the thing is not increasing. I said, how many times are you taking it? He said, once a day. Said, every 4 hours, be taking it. In 3 days, that lady stood up. In 3 days, that was towards the beginning. In 3 days, that lady stood up. Another family called me, and their child had come down with something that looked like it. I give the boy vitamin C, give him every 4 hours. In few days, that boy bounced back. Okay, vitamin C. And then don't forget I said if you go for the powdered one, it's better. Now, I missed out this one. Before you start using supplements, social distancing and masks are very important. They are very, very important. Please, I beg you, don't joke with when you are in a crowd. We are not asking you to wear your mask to sleep. You see some people, even when they are sleeping, you see some people when they are driving, him himself alone inside the car, the AC is wound up and he's wearing his mask. And then I said, what is all this one? That's not what we are saying. Kotonya, it doesn't reach that one. Okay? But when you are in close proximity with people, wear your mask, especially people you don't know where they are coming from, you don't know their status, you don't know their state of health, you wear your mask. Okay? Social distancing also very important. So back to the supplements, vitamin C. There's another supplement that is very useful in shoring up your immunity, such that even when COVID will go, it will spread. It will go more and more. For instance, now it's not as if cholera has disappeared. It's not as if cholera has disappeared, though. There's cholera. And from time to time, we hear that there was a cholera outbreak somewhere, but we don't see it every day. There used to be a coven in 1918, a cholera outbreak, pandemic happened. Okay? But we don't hear cholera everywhere. Not that it has disappeared, but the peoples of the world have developed an average herd immunity towards it. Okay, so that's how COVID will still hang around till we're all able to develop herd immunity. So one way or the other, infection will come. You will contact it one way or the other. So I heard somebody say, I reject it in Jesus' name. I reject it for you also in the name of Jesus. Okay, but listen to me. What to do is be careful, care about your own immunity, so that the things we have to do to not contact it are very high. It is almost impossible. It's almost impossible. What it means is, you go to a public place and then you sit down. How do you know that the person who sat there before you or yesterday didn't stay? And then they take their hand, and not necessarily rubbing it out of maliciousness, but at some point he said, "Oh boy," and then he has put it there. How do you know? So when you get home, and then you use this one to rub it, and then you use this one to rub it, and then you get home, it's only your hand you wash. You don't wash your clothes immediately. When your children will come and say, "Hey, daddy," they will touch you. Okay, so it's important you develop the immunity of your family. Vitamin C. Another one that will be very useful is zinc. Zinc helps in reducing viral replication. Zinc is very powerful. It enters the cell, and whenever it's inside a cell, when viruses come into that cell, they are it slows down. It reduces the replication. Replication means the multiplication of viruses. Okay? And now, that is, you have heard people say, I blended ginger, I blended garlic, and all that. That ginger part of it is zinc it is supplying. It is zinc it is supplying. So you can also go for supplements of zinc. Take about 100 milligrams on a daily basis. Okay, there's a higher dose that you can take if you have an active infection. Okay, but now it's important to note that zinc is charged. It is not easy for zinc to penetrate inside the cell, and that's the place of another supplement called quercetin. Quercetin is a zinc ionophone. It literally takes zinc by the hand and escorts zinc towards across the blood cell barrier into the cell. Okay, that's exactly, Trump told us one time how that in America they are using zithromas and hydroxychloroquine. That's the work of hydroxychloroquine. Hydroxychloroquine is a very active zinc ionophone. It takes zinc. You don't get zinc only from supplement, even from the food you eat. I just talked about ginger now. Okay, it takes zinc and helps zinc to cross into the cell membrane, into the cell. And when when zinc is intracellular, it will reduce the multiplication or the replication of virus. When I come back, I will continue. Please do not go away. I'll be right back. Okay, you're welcome back. We are talking about COVID-19, why it kills fast, and how to avert it. We've said so many things, all right? We are talking about the place of prophylaxis in taking us faster towards herd immunity. We said we can achieve herd immunity, that is 50 to 70% of the people having the antibody against COVID in their blood. That's herd immunity. Now, we said it's either we allow ourselves, we do a free-for-all, open it up, and let people just start getting infected. But we said that is dangerous, because in the course of doing that, many people would have died. Before we got to know a lot about COVID, that's why many people were dying. Okay, we said that's dangerous. We said we'll not do that. We said another thing that can be done is vaccination, massive vaccination of the people. But as we speak now, vaccines have not been approved. People are working hard, they are working around the clock, but vaccines have not been approved, because these things are not these things take time. They take time. Okay, now so we said we can also use natural supplements to naturally shore up our immunity, so that we will not be able, if we contact the virus, it will not affect us, or if it affects us, it will not take us out, and then our body will be able to quickly develop immunity towards it. All right, because the reason it kills the people it kills is because it rapidly grows in their body and takes their organs out and takes them out. Okay, so we said we can use vitamin C. We said zinc is very important, and we said it's difficult for zinc to enter into the cell, so you will also need to be on supplement quercetin. Quercetin. Quercetin is fantastic for allergies. Fantastic. I first learned about it when before I came into naturopathy. Quercetin. Somebody used to have asthma, and then one man told him about quercetin, and the person sent it from abroad, and then that asthma behaved itself. Okay, so some other supplements, especially in form of food, or you can also take their supplement types. Garlic is strongly anti-inflammatory. Garlic, turmeric, cinnamon. All these three are strongly anti-inflammatory, and they are also blood thinners. They are anti-inflammatory and they are blood thinners. Now, when we're talking about the pathology of COVID, we said that one of the things COVID does is that it leads to extreme inflammation. It leads to platelet aggregation, activation. It leads to it disrupts blood. It causes clotting of the blood. So there will be blood clots inside the system. Now, one of the things, so you need, that's why you need blood thinners. For instance, okay, let me bring it nearer home. Aspirin, remember, if somebody has hypertension, and especially if they're elderly, they will give them aspirin, what they call vasopressin. The reason they usually add aspirin or vasopressin is to thin the blood, so that or if you have heart issue, they will place you on vasopressin, so that you will not quickly, it will not be easy for the person to form blood clots that will lead to emboli and that will lead to a stroke. Okay, so all these are natural blood thinners: garlic, turmeric, and cinnamon. Okay, so you can take them. Take it twice a day. Be careful about ginger particularly. You can take them, or you can decide to take them as supplements. All right. Now, there's another one called, another supplement. This is a powerful one. I don't know why I didn't start with this one. I should have actually started with it. It is called N-acetylcysteine, NAC for short. N-acetylcysteine, NAC for short. When I would tell tell people in my consulting room about NAC, I would demonstrate it. NAC it. NAC is powerful. Why is NAC powerful? NAC is a precursor means raw material for formation of the mother of all antioxidants. The name of the mother of all antioxidants is glutathione. It is even senior in the antioxidant ministry to vitamin C. Now, glutathione, when you drink it, take it, ingest it by mouth, it's not well absorbed through the intestinal system. But NAC is very well absorbed. When it gets into the body, it will now form glutathione. So the first reason why NAC is important in this fight against COVID is that it helps to fight glutathione. And the work of glutathione, like we said, it's the fact that it is a reactive oxygen. It fights against reactive oxygen species. It fights against oxidation. Other things that NAC does for you is that it reduces platelet aggregation. Remember, we said COVID is so terrible. The reaction it elicits will cause aggregation, gumming together of the platelets, and that's what causes clotting of blood. Okay, so it reduces platelet aggregation. It also reduces fibrosis of the lungs. It reduces fibrosis of the lungs, and then I wrote here, it breaks disulfide bonds, thus reducing thrombosis and platelet aggregation. So NAC very important. Be on zinc, be on vitamin C, be on NAC, and then there's one more I left: zinc, vitamin C, quercetin, and NAC. And then anything also you do to alkalize yourself is helping you against the fact of in the fight against COVID and against many other things in life. Anything you do. So drinking and blending and drinking of blended vegetables. Most vegetables are alkaline in nature. Drinking and blending them regularly helps. Reducing eating of acidic foods. Reducing your intake of animal sources, maybe only fish, and then reducing intake of sugary things, reducing intake of wheat-based food will help you to be more and more alkaline. Okay, and then also you can look for alkaline drops or anything that alkalizes your water. There's only one water that is truly alkaline in Nigeria, but I will not like to say the brand over the air. Maybe if you call, we'll be able to tell you what. But there's also, you can get, what I encourage our people to do is get alkaline drops. Just a drop or two in the water you are drinking, and then you alkalize the water. Praise the Lord. Now, my time is up, but then if you eventually develop the sickness, Okay, and it's no longer moderate, it's mild now. You are feeling a shortness of breath. You will, of course, by that time you should call NCDC people, and then they will tell you what to do. Actually, many times if you call the NCDC people, if it's still mild, and they do your test for you and your post, they will send you home and tell you the things to do. Some of these things that we are telling you, don't self-recommend, because there are some people who can take these things. Okay, but I'm just telling you for information's sake, there are things you can do that can even combat COVID at the mild, while it's still at the moderate level. People have recovered from that level. Okay, so my time is up. I would like to remind you of our books. We have 4 books published. There's Reversing Diabetes Naturally, okay, and there's Reversing Hypertension and Cardiovascular Diseases Naturally. There's also Reversing Depression Naturally. This book is a fantastic, all the books are fantastic. And then there's also Sickness Free, fail-proof protocol for regaining and retaining health. I believe that you have gotten something from what we have shared today. All right, don't forget, always consult your doctor before you use any of those things that we have talked about. It's only for information purposes. All right, just to let you know that there are things to do. We are not helpless any longer against COVID. We may have been helpless those initial first few weeks, but now God in his infinite mercies have revealed some of these things, and if you do it, you'll come out with a testimony. All right, do not forget to send in your testimony. A whole lot of people I met have been taking. One man told me, he said he started watching me about 5 years ago, and by that time he was on insulin for his diabetes. He said after he started doing the things I was saying, his insulin that was even hitherto uncontrolled, his blood sugar that was hitherto uncontrolled, even though he was on insulin, became controlled, and eventually he was weaned off insulin. 4 years now, he has been weaned off insulin and is doing very well. We have all manners of testimony. So don't forget to send your testimony. It helps us to encourage others. Okay? God bless you. Thank you for watching. Listen to me. When it is all said and gone, COVID has lost all its power, you will still be standing, you and your family. Amen.